Okay, so this is Charleston Cooper and the contents of my first aid kit. First over here, we have hand sanitizer along with sterile gloves. Next to that, we have small bandages. These are used for just little puncture wounds, along with a safety blanket because this is also an emergency survival kit. Going to the right, we have moleskin, which is very useful on hiking trips and also for any blisters that can occur. Just some sterile gauze, some small ones for medium-sized wounds, a little bit larger, and then the big one to wrap around. We have a multitude of band-aids, all about the same size, and a couple bigger ones. We have an instant cold compress. That is to apply cold to the wound. We have this wrap. It's used for larger wounds if you need to wrap it to keep pressure on. Insect protection cream, that's for if you have a patient that has had an insect sting or something and you need something to make sure that they don't have that happen again. Lip ointment, this is for just for chapped lips mainly. Burn cream, if they have a burn, it's what you would want to use to help clean and medicate the wound. Splinter removal, fairly self-explanatory. You want to use this to help remove any splinters they might have. Emergency drinking water, this ties in a little bit more with the emergency kit aspect of this, but it also can be used in situations such as dehydration if you have no other way of getting them water. Butterfly closures, these can help to pull together larger wounds until you can get proper stitches or things like that. These knuckle bandages are really good for injuries on places where it's not very practical to have a large band-aid, but you still need to keep it covered. Antibiotic ointment, this is just to medicate simple cuts and scrapes. Aspirin for pain relief. Insect sting relief. This is just exactly what it sounds like. For use on insect stings, it helps calm the pain and just kind of numb it and make it a little bit easier to deal with. This stuff is in case you have a run-in with some poison ivy or poison oak to clean it, to try and get those oils off. Simple cotton tip applicators, these are if you have like isopropyl alcohol or something like that to clean the wound with. A whole multitude of alcohol prep pads. These are just used to clean off simple wounds. Some antacids, stomach issues. And then non-aspirin for those who can't take the aspirins. I have some sunscreen. This is for people who have problems with sunburn. Hydrocortisone cream. These are for simple skin irritations or rashes. Eye pads. These will help you keep an injury in the eye area under control. And then finally, Bright Stick. Obviously, just more on the survival kit aspect.